So when we get it started, I do believe Laura is on, right? Laura is going to do our land acknowledgement. First, I want to welcome everybody to the Homeless Prevention Response System Advisory Council monthly meeting. It is a mouthful, and it's only taken me 2 years to be able to say it fast 3 times. But anyway, want to welcome everyone. Our work is, well, I love that mission. I mean, that's the mission of the coalition. Our work as the COC is really to kind of oversee the health, there you go, of the Anchorage Homeless Response System as a whole. And in part, a lot of our work is around the compliance with the COC Continuum of Care funding that comes into our community. And this year is a little different, unique. Usually about this time, we would be all pressured to start saying, it's time to start meeting because the NOFO is out and we're ready to go into competition all over again. But last year, if you remember, it was, we approved a 2-year, it was we worked toward a 2-year funding cycle. So therefore, right now, most of us are working on our contracts for the funding that has been secured for the year that begins, I think 10/1 or September. It's one or the other, September or October of 25. And then we'll go through 25 and through 26. So that being said, it's giving us time and pause as a response system to evaluate our systems, evaluate our committees, figure out ways that we can do better in engaging the public to participate in this process, and making sure that as a advisory council that we have opportunities where we can share out some of our learnings, but more important, learn from you guys and learn from those that we're able to engage, especially those with lived experience, as is a priority for us this year in particular. So that being said, I would like to ask Laura if she would do the land acknowledgement.
Hi, everyone. My name is Laura Cox Wilson, and I'm the Director of Supportive Housing at NeighborWorks Alaska, for those of you that are joining us for the first time. I am honored to do the land acknowledgement today. A land acknowledgement is a formal statement recognizing the Indigenous people of a place. It is a public gesture and appreciation for the past and present Indigenous stewardship of the lands that we now occupy. So as we begin this meeting, we want to respectfully acknowledge that we are gathered on the traditional lands of the Dena'ina Athabascan people. The Dena'ina have stewarded this land for thousands of years and continue to do so today. We honor their ongoing connection to this land, waters, and community. We recognize the enduring presence and contributions of Alaska Native peoples across the state and are committed to uplifting Indigenous voices, histories, and leadership. As a collaborative group working to support and house members of our community, we acknowledge the legacy of colonization and its ongoing impacts, and we affirm our responsibility to promote equity, justice, and partnership with the Indigenous peoples of this region.
Okay, thank you, Laura. Does anybody have a mission moment for us? So a mission moment is just what it sounds like, a way for us to talk about the mission and our work, and a moment captured in time about a service, a particular something that was witnessed, or some way that we would want to share and kind of uplift our work. Randy.
Hi, and I'm sorry, I was contacted and asked and I did not respond. It's been a little bit hectic. Mine is a broader base mission moment because many of you guys are probably aware Awake has undergone a lot of ups and downs, specifically with our work within the COC, and in particular our rapid rehousing. And so we were very happy and proud to have housed 19 families and fully expending our rapid rehousing dollars. And so It was a lot of work, but we were excited to have reached that milestone because it was a long time coming.
Well, everybody's giving you a clap. And it is hard. And thank you. I mean, you're new in that space. You stepped in, you looked at it, and are fully engaged in it. So just want to acknowledge that. And thank you for prioritizing that and prioritizing getting these families in safe spaces. So thank you. You know, I have to say that a mission moment is that, you know, all of our you know, our, whatever you want to call it, all of our projects are actually going to contract, right? And, you know, I think there's moments when we were anxious about what the delay might look like, what the changes might look like. My understanding is that our local field office, which shout out to still having a local field office, is getting ours all ready for agreements. So that is something that necessarily wasn't a given, and everybody had ample amount of anxiety around it, but yet we do know that they're going to contract. So that's a positive. So Mitch, you got your hand up?
Yeah, I just wanted to let you know that we have a quorum now.
Sounds good. So why don't we look at our agenda and see if anybody wants to add anything to the agenda. Typically what we do is we approve the consent agenda, which offers the approval for the March minutes. So the minutes have been attached to this, and then approves or adds any changes to our April agenda. So what would be the will of this group?
This is Sharon. I'll make a motion to approve the consent agenda.
Thanks, Sharon. Do I have a second?
This is Farina, I second.
Thanks, Farina. Do I have anybody that needs to add anything to our agenda? Going, gone. So we will approve, and seconded by Farina, approved by Sharon, moved by Sharon, seconded by Farina, our agenda and our March meeting minutes. And so now I am very happy to introduce State of Alaska is in the house, and they are going to be talking to us. Gosh, I'm not even sure I know how to say that second word. Alaska's Syndromic Surveillance Program. Hopefully I didn't butcher it too bad, Anna, but I do know that Anna is there, and if you can, and I think you said you had somebody else with you. Matthew, is Matthew with you, or?
Yes, I brought along two friends today. So I'm Anna, I'm with Section of Epidemiology, and then I brought along Matthew Forrester, who I think a lot of you guys have met. He's with, I forget the name of your actual unit, I just call it Homelessness
Health Intervention and Prevention.
There we go. And we also brought along our fellow Suzanne, who's in epidemiology, and was curious to meet you guys.
Got it. Well, we just all want to say we love epidemiology, and and that we are actually, no, really, we're actually very excited to learn. I have known for a long time that the more I understand our data, the more I understand our numbers, the better we are as an organization. And I know that that goes system-wide, statewide, and a lot of different spaces. So help us understand what the Alaska's, is it Syndromic Surveillance Program is?
Yeah.
There you go.
Can I show you guys some slides?
You sure can. You've got the run of the deck.
All right. All right, cool. So we already talked about this, but let me tell you a little bit about these data and where they come from. So our syndromic surveillance platform is emergency department data. The way it works is that we collect data about all emergency department visits at participating hospitals. All of the hospitals in Anchorage, or sorry, all the civilian hospitals in Anchorage are participating. The way it works is when someone shows up to the ED, the nurses there will start entering data about what's going on with them. That updates things in the electronic health record, and then the electronic health record on the back end will start sending standardized automated messages to my database. So we get a little bit of information about everything. We don't know everything about what's going on with that person, but we know like some sort of brief summary information. It's important to note that these data are not named, so I can't tell you who that person is. There are some limited identifiers, so I can use these data for case investigation if we need to, but I have to sort of call the hospital and say, there's a person with this medical record number and this birth date who is at your hospital on this day, and I would like to know more about them because of this reason. So these data come in really fast because they are sort of all done by the computer on the back end. Usually, the requirement is that the data have to be with us within less than 2 days, but usually it's faster. I know things about this morning. And then there are updates that will come in a little later. It takes time to get diagnosis codes and lab results in, but generally speaking, the data are sort of extremely fast. And the fact that it's standardized and automated is really a hallmark of the way these data work. It's what lets them be so fast. It's also like the reason that it sort of works at all. But it does mean that they don't get as much human touch as other data sources that you might have worked with. And so you got to think about the way that AI works. Now that everyone touches AI all the time, it's much easier to explain. It does dumb computer things sometimes, but for the most part, it works pretty well. I usually express these data in terms of their strengths and weaknesses. So the things that are great about it are that it's fast, it's flexible because we get data about all of the visits and then we look through it for the things that we're interested in. We can change what we're interested in at sort of any time. And then it's very convenient because we can automate a lot of our workflows for it, and because we don't have to make a lot of expectations on the busy staff at hospitals. We can just let the computer do a lot of work. The limitations are because the computer does so much of the work, we end up with a lot of sort of imprecise things because what isn't there isn't like a doctor telling us this is an event of the type that you're interested in. We're asking a computer to sort of approximate that for us. Emergency departments are very busy, and so there's a lot of noise that comes into this in terms of the number of people who have a certain condition that is just related to like certain days of the week are busier at the hospital. Sometimes there's like weather going on or spring break or all kinds of things can affect ED volume that have really nothing to do with people's health. And then this one's not relevant to you guys because the hospitals that you care about do participate in the system, but I don't have quite all the hospitals yet. And then it's also, of course, the emergency department is a weird slice of healthcare. It is a very limited slice. It doesn't tell us about inpatient data. It doesn't tell us about primary care data. It's just the emergency department. All right, so I'll tell you about some of the things I know we can do with these data. Does anyone have any questions about how this works?
Question from Olivia.
Yes, ANMC does participate in this system, which we're very thankful for. Cool. So what do we do? So here are some examples. I've been doing surveillance for folks experiencing homelessness using the system for a while. That was something people were really interested in knowing more about, especially during the pandemic. So I've done some work to see what we can do about finding people. The search terms that we're using now uses a mixture of ICD-10 codes for those Z codes that are for housing insecurity type codes. We also have keywords. I've modified, so there are basic keywords like shelter, and then I've also modified it to include the names of specific service providers and shelters. We can also make changes to this, and of course we can further refine the search to like look for other things that we're interested in. If you just look for those terms, here are some examples of things that you might find in there. So I won't read them to you, but those are some sort of example visits that this query would find for us. And this is the one that doesn't have abbreviations expanded. So you know, AFD is of course the fire department. BIBA is usually an abbreviation for brought in by ambulance. So there's, hopefully you've had time to read them all, but that's the kind of things that it returns for. And if we're interested in, you know, certain specific things, we can look through that data further to, you know, if you were really excited about flu among folks experiencing homelessness, we could look for those cases. Here's monthly counts of ED visits for sort of the results of that query. The counts are in yellow and that bar is on the left, and the proportion of all ED visits is in purple, with the scale bar on the right. It's been pretty consistent. Sometimes there's a bit of a seasonal swing. It depends a little bit on how winter was. Since this last winter was relatively mild, you don't see quite as big of a swing, but usually in the fall, like you can notice the number sort of start to incline increase as the temperature drops. Here's just a basic table of some demographic stratifications. So perhaps unsurprisingly, the number of men, or the proportion and number of men, are both much higher. And there's, you know, an age strata that sort of emphasizes people in a certain, you know, it's mostly adults in a certain bracket there. I don't imagine this is terribly surprising to you, but I actually don't know if this matches the demographics of the homeless population in general. So that's something we could look into pretty easily. And then some other ideas that I have about things you might be interested in doing with these data. This is we can do anything you're interested in. Here are just some thoughts about stuff I knew we could do. So we could look through this to say, what are the reasons folks are visiting the emergency department? We could think about that in the context of the acute reason for visit. So we'll certainly see lots of people with hypothermia or frostbite concerns in the winter. Like we can quantify that. We can also look for co-occurring comorbidity type stuff. So the presence of chronic conditions, you know, people will have ICD-10 codes for things like diabetes or any other conditions they may have, and we can follow that as well. We can also look at changes in activity. So like I mentioned, we'll often see changes winter versus summer. We can count those. We can look at long-term changes. So are we seeing similar numbers of ED visits over the longer term? And then I don't know how much you guys do in terms of emergency response, but we can certainly use these. When we were getting ready for volcano surveillance, if Spro blew up, I was certainly had this query on my dashboard, planning to make sure that that was a group that we were checking on. There are lots of other things we could potentially do. I have no idea what would be interesting to you, but these are some things I know for sure I could successfully execute for you.
Hey, I'm sorry. I don't know if you can see the hands up anyway, but I have a question, even though I put my hand down. But can you also track discharge and disposition? Like where do they go? And are they going with somebody, or if they're coming in, like, can we find out any kind of details about if they're escorted in any way or assisted in any way? You know, it could be a staff from a program, or it could be a family member, but just curious about tracking disposition.
In terms of who might like come pick someone up, that part would be like a text field. Sometimes that's data that I have, sometimes it's not. The idea of discharge disposition is a coded value that the computer will send to me. So I do always know their like conceptual disposition, which is usually something like discharged home, admitted, transferred, something like that.
Is it okay if I ask a question?
Yeah, I was gonna say, that's great. Randy has her hand up.
Okay.
Yeah, I was
I
was curious. Oh, go ahead.
Sorry, you guys can hear us, okay. Roger had a quick question and then we'll go ahead and go to you after that. Roger, please go ahead.
Sorry, there's a delay in it. Are you guys working with MIT with the Anchorage Police Department or MCT with the fire department? Just in terms of maybe identifying if their program is working or not working, when I know one of their goals is to divert, you know, the number of ER visits for mental health crisis, and for them to kind of keep them within the community without that visit.
You know, they actually have not asked me about data for an evaluation project, but that's something I could look into. Fairbanks has talked to me about wanting to evaluate their crisis now, in a similar way. So that's something we could do. I have not specifically talked to them about it.
I know Farina would be really interested since they're diverting a lot of money that way.
Yeah.
I actually smiled incredibly large when you asked the question because I was thinking, I wonder how we can get a copy of this data because this is going to be incredibly useful for our crisis work group.
I'm happy to talk about that, but let's,
So
yeah.
my question is very related to Olivia's, but, so the department has a psych ED?
Yes. That's a good question. I'm pretty sure that it's all coming this way, but I have not technically validated that I'm receiving both. Just based on what I'm getting, I'm pretty sure that I am, but I should double check that. In fact, I'll write myself a note to do so.
And this is very powerful stuff. Thank you for doing it, and thank you for coming and sharing.
My
You
pleasure.
know, but crossing over the psychiatric data and the MIT, the MCT, data to how many people are homeless, you know, that would be very powerful stuff for. So, just a comment.
Yeah, looking to be helpful.
Yeah.
Are we still getting an echo? Sorry, just a little, cannot, there's an echo for this.
It was mainly you, Yvonne, and I'm not sure if it was where you were seated. It was when we were trying to hear if Randy could go. We couldn't hear that you were saying at the time Roger wanted to speak. So I think now we're okay. So thank you. And I see Olivia's hand up.
Hi, can you hear me? I'm sorry, I'm using my phone, and so I had several questions, but before I ask that, is the slide finished or are there more to the slides?
Oh, I think that's my last slide that like matters. I might have one on, yeah, so go for it.
Okay, so my name is Olivia. I'm the Vice President of Primary Care with South Central Foundation, which is part of the Alaska Native Medical Center. And so, so some of the questions I have is I think you answered the first one as far as you guys capture the data from the Alaska Native Medical Center. We also have if folks don't know, we also have a clinic at Covenant House as well as a clinic in the Brother Francis Shelter that serves, mostly adults, but really all ages. And so, and we have been consistently trying to, drive and push access to that so folks, including the homeless population, can see. So some of the data I have a question on, it just went a little too fast for me. Can you tell me the number, what's the aggregate total that you have that visited the emergency room? Is this the past FY24 or is it, how many years are you looking at?
So I have data by month here. I'd have to go back and grab my spreadsheets to cross-check what our annual total of visits were. But I do think allowing for seasonal variation, it's sort of somewhere around 400 a month is the average. Yeah. And I don't
400 a month?
Visits a month.
Visits a month. And do you know how many of that are unique patients?
So one of the limits of these data is because they're not named, it's quite hard to see who's a person. I try to avoid in a lot of ways looking at analysis by person. We usually look at it by visit. Within the same hospital, I can disaggregate on medical record number. And so if someone's visiting the same facility lots of times, I can monitor that. But if someone walks into ANMC and then walks out and walks over to Prov, I won't know that that's the same person, other than it's not uncommon for the ED folks to write in the notes that has happened.
And then I think maybe this may be my last one, but do you know if I may have missed it, that is this the majority of the visits to the ED are truly urgent emergency, or is it more urgent, could be done in an urgent care type cold flu?
That would be a great project for us to look into. Real mixed bag. So there are a lot of both.
Okay, that's helpful to start. That's all I have for now. Thank you.
Yeah. Does anyone else have any questions for me?
Those are great questions.
Just build on, I assume you also have data with API or no?
No, I don't have data from them. I think if we transition to onboarding more inpatient type data, then I'll probably try to target them as a partner. Because of the like funky style of analyzing these data, like it really thinks about itself as like a fast by the patient level thing. I haven't targeted them because that's not sort of how their care system is like. They don't operate in that same way. Similarly, that's part of why we don't usually recruit primary care providers to this, because you end up like the way that care is provided just doesn't sort of line up with this immediate real-time kind of analysis style.
That makes sense.
Yeah.
It would be great data to have, but the limitations make sense.
Yeah, again, like as we move towards CDC really thinks I should onboard inpatient data to these systems. So in that case, I'll probably be like, well, if I'm doing all the other inpatient locations, might as well have psych hospitals too. My friends in Oregon have talked about onboarding psych EDs and sort of exclusive standalone behavioral health emergency situations, which I've heard that is going pretty well for them. So that's on my radar, something to keep thinking about.
And there are a couple of like pilot projects around now, the crisis now.
Yeah.
Olivia, do you still have your hand up or okay? Or do you
Yeah,
have a question?
I just have one more question, and I appreciate the data. Any data is I think it's great to have. But could you tell us what is and I may have missed it, what is the purpose of you showing this data to this group, and what would you like us to do with it?
Wonderful question. So I'm here today because Sam and I were talking on a different place. And she thought that you guys would be interested in these data as something that you could have and that we could work together, and I could provide data to you / Matthew could provide data to you using these data for whatever purposes you think that they might meaningfully serve to you. But because these data are kind of funky to work with, we thought it might be easiest if I came and talked to you about what they are and what they can do. And then we could collaboratively come up with a good data request that would let me meet your needs effectively and would minimize the amount of paperwork / discussions with my departmental lawyer I would have to engage in. So
Yeah.
that's what I'm here for, is so that you guys would know what these are, you could tell me what it is you want, and we can figure out how to get it to you.
And actually, just to even add on to that, Olivia, it's a great question. One of the areas that we continue to not maximize our points on as a COC application is the integration of healthcare, hospitals, ER visits, communications around our understanding of it and participation of these hospitals in a coordinated system of care and a homeless response. And so one of the things that we were all thinking about was, well, how do we get data? Because we really have always been on the outside of this data. And so this was kind of the first attempt at understanding where information sits in our community about access of ERs in our community by those that are experiencing homelessness. So that might add to kind of clarifying what Anna is here for as well. Will, you have patiently had your hand up.
Thanks, and thank you all for coming and presenting to us. I'm curious, do you have data on like insurance status or anything like that? My kind of underlying question to that is ultimately like kind of the thinking about like the cost to the system and everything, and like the rate of visits for people experiencing homelessness relative to like general population.
No, unfortunately, that variable is not consistently captured in this data set. I know that it is in HFDR. So, or in the like the discharge data that is managed by our Vital Stats program. They do have insurance consistently there, but I do not in these data.
Sharon.
Yes, well, thank you, Anna and Matthew, for coming, and I really like to thank Samantha. She's not here, but she's the sort of linchpin that got this, relationship going. And so and in case you didn't know, I'm the chair of the data committee, and we've been talking a lot last month in our committee about this, and we will be inviting you to next month's meeting because we sort of thought that it'd be good if you were to come and sort of present this data source to us, and then we could, as a coalition advisory council, sort of decide if we want to go further. Sounds to me like there's a lot of interest in that. And then that we would sort of discuss the nitty-gritty at the data committee where we can get into a lot more detail. But I think if anyone here on the advisory council wants to get more involved in the data, they're welcome to come to the data committee meeting or just reach out to me. Or actually, there's a lot of overlap between the committee and the advisory council. We're one of the happening committees. So that's exciting stuff. People who love data, they love data. So yeah, so it occurs to me like one of the most interesting things would be to compare just the demographics of the people who show up in this data set with the overall maybe just the population of people experiencing homelessness demographically, as we can measure through HMIS or something like that, just to compare those. And then I'm also interested to see whether this population who present to the emergency departments are different, if the homeless subset is different than the overall population who present at emergency departments, to see again demographically. But that's just the tip of it. I think there's a lot of really interesting and exciting questions that we could look at and collaborate on. So
yeah,
so thank you for coming. Yeah.
Yes, definitely. Thank you for coming. Thank you for identifying what is a resource for us as a council and as a community, right? And understanding the impact not only on the healthcare system, right, but on the individual, right? That they're trying to access services through the ER. And like Olivia said, there's people on there that is 14 to 24 that could be accessing at Covenant House, and I'm wondering if like we had some information about the detail of it, whether they came by ambulance or what, and see if there is a way that we could accommodate in our walk-in services, or Brother Francis. So all great information, really appreciate. And we'll figure out what are some of the next steps, whether it be through Sharon or any other committee. That is a sneaky way, Sharon, to get people to join the data committee, but it just may work. You never know. You may have us all there, wanting to be data people with you. So anyway,
Ooh,
so I
that's
thank
fantastic.
you. I don't see any more questions.
There is one.
Okay.
This isn't really a question, but someone else had asked a question. I forgot who about the EMS system or the mobile crisis teams. And I'm going to admit up front, I don't, since the implementation of those, I don't know how it all plugs in together. But there is another data system that tracks all EMS visits. Whether they transport or not. It's also de-identified data. But they do keep a record of every call out basically, and that's administered not by Anna, but by a whole different set of people. But that information, that data is out there as well in DOH. So Brian Emmons manages that system.
Sharon is going to end up having us all sit in data, right? She's going to be starting to pull all kinds of information for us. So thank you for bringing that information forward. Do I have any committee reports? Committees that have met and want to share? Share out, shout out or share out. Sharon. There she goes again, plugging that
Okay.
data.
All right, well, since we're on that, so yeah, we met last week. So we did discuss this syndromic surveillance tool, so I'm very glad that we're moving along on that. We also we discussed the survey instrument. We had a draft that we reviewed in the committee. We'll be continuing to look at that. And just as a reminder, this survey is would be administered to agencies to ask them about how they use HMIS, the utility of it for many of the utility of HMIS for their agencies, to the extent to which they find entering data into HMIS is are there any barriers, and what do they need to do a better job? Anyway, so we're moving on that. And then we also discussed a sort of reimagining of the committee, or what the purpose of the committee is. And in particular, this would mean that it would be an organizational change, and it relates to the AK HMIS Advisory Board. That because right now we have a AK HMIS Advisory Board, and then in our COC we have a data committee that has some sort of responsibility for oversight of AK HMIS, but the balance of state COC does not have a data committee equivalent. And so there's some suggestion that perhaps what the data committee and the AK HMIS Advisory Board are doing is duplicative. And so as a committee, we discussed it, and we decided we liked, as a committee, the idea of having the data committee not perform that AK HMIS oversight role anymore, and having that just be done by the AK HMIS Advisory Board. And so we're going to propose, I meant to have something to present today, but I don't. It's the end of the semester. I'm busy. But certainly by next month, we'll have a formal proposal, perhaps a resolution that would talk about the reorganization, propose a formal relationship between this body and the AK HMIS Advisory Board in terms of having members from our council that are appointed by our council to the advisory board, and also having perhaps an ex officio position on our advisory council who is a member of the AK HMIS Advisory Board, like perhaps their chair or something. And then perhaps a mechanism for sort of routine reports from the AK, so many acronyms, the AK. I hope everyone knows what I mean when I say AKHMIS. It's the Alaska Homeless Management Information System. And so perhaps the chair of their advisory board would give quarterly reports to our advisory council or something. So that would mean, beyond just that structural change, revising the board, I'm sorry, our committee documents, and also the advisory board governing documents and the governing documents as a whole. And yeah, so
Hey Sharon, when is your next meeting? Just so we have it on everybody's calendar. If anybody wants to join and really understand the role of data, what the governance charter is on that. This might
so
get
we
you
meet
some new members.
Yeah, we meet on the third Wednesday
Okay.
of each month. Yeah, and so next month it's weird. So we actually have our data committee meeting the day before the advisory council meeting. And that just happens because the first day of the month is a Thursday, anyway. So yes, it's the 21st
21st, got
of
it.
May. And we meet at 3 p.m.
Okay.
and generally go till 4. The attempted adjournment at 4, but it's not hard and fast adjournment.
Okay,
And that is on Teams. And then we've also been meeting in person at the NeighborWorks Alaska building.
okay, at
They're excellent.
NeighborWorks. Got it.
Yeah, they're excellent hosts. So
Okay. 3
sounds
p.m.
good.
on the 21st of May at NeighborWorks.
Yep.
Okay,
Yep. And then the other thing we talked to is that Will is going to the an upcoming data conference in New Orleans, I believe, with some other folks, and he just wanted some discussion of the committee about what are things that he should maybe focus on in trying to whatever information he's going for. It's going to be a lot, I assume. Be
Yeah.
very exciting. So, all right. Are there any questions for me or comments?
nope. Sounds
Nope.
good.
All right. Thank you.
Maybe Will go next.
Sure, I can do that. So I chair the Community Priorities Committee. We met a couple times this month. One of the things we've been working on, as was tasked to us during the Advisory Council retreat, was to work on kind of restarting and kickstarting the kind of platform for those with lived experience. So we've been working on restarting Iraq. If you'd be interested and enjoy participating in that, please come join us. Similar to what Sharon was saying, we also talked about kind of ideas for what would be of interest to be kind of talking to other communities about at the conference next week. In between the two committees, some of the ideas looking at kind of equity in service delivery and outcomes, especially in the current environment, looking at coordinated entry ideas and what other systems are doing there, program evaluation and incorporating that and feedback into the application review process, data security in the current environment. Let's see.
And Will, is your committee one of the only committees that meets twice a month?
Probably, yeah.
Or is it twice a month or weekly?
Every other week.
Every other week. Okay.
So the next ones are May 5th and then May 19th, and we meet 4 p.m. on every other Monday at the Coalition office. Also available hybrid over Teams.
Okay.
Compliance committee.
Compliance. There you go, Roger. I was about to say, I think I have left compliance and coordinated entry, right? Okay, Roger.
So update on the compliance committee. I have been working with the coalition for it's been about a year trying to get the Iraq thing going. There's been a lot of movement in making that happen. And I'm looking forward to seeing that happen and to getting the compliance committee more active within here. I appreciate the new energy. Randy is kind of put a toe in the water to come on board, so I'm excited about that. And I'm waiting on some ducks and some things that I can work with Jessica on. I was hoping we could have maybe made some progress today, but her airplane did not cooperate with everybody. So I should have more of an update next month, but I'm looking forward to rejuvenating and re-energizing the committee.
Got it. Thanks, Roger. Coordinated entry. Is that Laura?
Yep, that would be me. So we sent out a doodle poll to see when would work best for everybody. We got back a bunch of different responses, and so it seems that our next meeting will be Thursday, May 15th from 3 to 4 here at NeighborWorks, and then of course on Teams as well. We are always looking for new members to join our coordinated entry committee. And we will be working in our subcommittee, which is evaluating coordinated entry, and we will be kind of rejuvenating that and getting that back up to speed so that we can have a full assessment of the coordinated entry system done by August 1st.
Good job. Okay, any other questions, follow-up questions from anybody else in the meeting? I know that we're doing some work on the website to be able to have all these committees up, posted, updated, calendar, agendas. And I know Jess is not here to talk about that, but I'm not sure the status of that. I know that we had a couple of community members reach out to me about that, having some of these documents posted for transparency.
This
So,
Roger?
oh, go ahead, Roger.
Yeah, the update to that was that they have been updated, the website was done, and the individuals in the community that were concerned about that have reported back to me that it's all up there except our very last meeting. And I'm thinking that there's probably gonna normally be a 30-day lag, but we need
Oh,
to
that's
clarify.
great.
Yes.
Hey, thanks, Roger. Hey,
Yeah.
I see the hand up for name of test. So test, do you have sorry, I don't have your name, but if you have a question for us or a comment.
Yeah, hi, Allison. This is Jamie Lopez. Sorry, I'm currently over at a food pantry, volunteering, one of them that I do about 5 to 6 a week. And so my concern is obviously there are lots of things. Maybe I'll take a more active role in the future to help out. But Neilani Walker is outside. I bumped into her last Thursday, and I'm never around trying to find her. She can't. She's reached out to Phil Cannon, and so my concern is that it's been a month, and you know, I was hoping that there would have been more movement for the Stein House
So,
specifically.
Hey, I'm sorry, it may
yeah.
be me, but I can't hear you very well. It's breaking up. So, yeah, maybe if you're, it's like your phone is in the microphone, but
would-
I mean, your ear is in the microphone, but I don't know. It's kind of breaking up here.
Yeah, Jamie, try turning off your
Okay.
camera. Sometimes that works with the audio issues.
Say that again.
Turn off your camera and then just
Okay.
audio
Okay,
it, and
stop.
maybe,
That
go ahead.
video. Okay, does it work now?
Yeah, much better.
Okay, sorry about that. Okay, I'll start again. So Jamie Lopez, obviously formerly Coalition. I might start to take a more active role in trying to help on this side of things. Obviously, I was going to camps up to 2 a.m., 3 a.m., 4 a.m., and I was doing it regularly. And so I'm taking a slight break for the past week. But with that said, you know, I was hoping that there would have been more movement to try and house Neilani Walker over the past month. I know there was an offer to put her in the hotel, but the main issue is that you know, she's trying to get some of her dependents back, and being placed in the hotel isn't really going to get her on that path. I know Farina Brown was trying to find her over the past couple of days. I spoke to Phil Cannon yesterday, and he more or less mentioned that as well. Yeah, I hope that somebody from Coalition will try to make good on the original offer to house her for a year, give her case management, and that would allow her to get her family back and get some stability. If you need any assistance in trying to find her, I am willing to go and locate her. But yeah, even though I haven't been talking to her the past week or two, I want the best for her, and I think you know, there should be try to be some movement on that. Sorry, I'm volunteering at a pantry right now.
Yeah,
somebody
no,
behind me.
yeah, we can totally hear you.
Okay.
So let's see, I think I see a couple of people from the coalition specifically. Can you
Yeah.
guys make sure that this message gets to Jess or whoever is kind of handling this, and then get back to Jamie on this one?
So I can speak to that. So yes, we are aware of Neilani's situation, and Jamie does have some of the information, but not all, and we're not actually supposed to share that information. It's yeah. So we're not going to comment on it at this time, but yes, we are aware.
But Yep, you're aware and you're working on it.
Oh, yeah.
That's great. Just want to
Okay.
make sure we pass that on.
Okay.
And thanks for bringing it up and for following up on her behalf.
Well,
Sounds like-
I'm just trying to follow through
Yep,
because
yep.
I've seen a lot of times where things fall
Yep.
between the cracks.
Yep,
So, all right,
that-
thank you very much. I got to get back to helping here. And
Yep, sounds
yeah.
good. And thanks
right.
for volunteering there.
All right.
Thanks.
Yeah,
Bye-bye.
thank you, Jamie.
Okay, so do we have any good news or community events coming up?
This is Sam. I can throw one out there and I can email a link out later. But if you're not aware, May 13th to the 15th at the Denaya Center is the Pathways to Recovery Conference, which is a substance use behavioral health focused conference. It's the first one of its kind in Alaska. It's going to be really exciting. So yeah, I can send out that registration link if that would be helpful.
Do you know if they did any scholarships for
They're specifically travel scholarships. So if somebody's looking for a different, I would still apply under a travel and see if they can allocate, some funding towards that.
Cause it was like $200.
Yeah, it is. It's a spendy one.
And so.
Yeah. I would, sorry.
No.
Registration has been updated to reflect the travel scholarships now. So if somebody is looking for funding support, I would go back through that form and click travel support.
Cool, that's
Yeah.
awesome. And it should be a good conference. It looks exciting, looks really exciting.
It's gonna be good.
So thank you. And then in other news, Duke was in camp Wednesday. He's starting to try to get something regular going with food and whatnot. And it's exciting to go out and participate in those.
Sounds good. I will say that Covenant House is hosting a community sleep out at Kincaid Park on May the 2nd. Happy to say many partners on this call are in partners with us that night. So I know Awake is there, Catholic Social Services, the Coalition, Volunteers of America, and I will stop before I forget somebody, but it is a community event. It is designed to raise awareness and conversations. We specifically focus on TAY young people, but definitely would love any partners or anybody wanting to be there in that space with us. I'm trying to find details, but what I will do, I'm always the worst at advertising these things, but I will get a flyer so that it's sent out to the community, and definitely would love to have you there. Love to have anybody there standing in solidarity for young people and others experiencing homelessness. And I think it's one of the, they lock us in at Kincaid Park, so we'll be there. We'll be there for the night. Unless Farina has the key. Okay, any other community events? Please make note of all the different opportunities that are happening in our community for advocacy and outreach. Looks like there's some great events organized at the Coalition office. Next week there is outreach going to Davis Park. May 6th is the regular assembly meeting, and May 20th, another assembly meeting. May 7th, my birthday, not that anybody cares, I'm getting too old to celebrate, but we'll be sliding through another one on May 7th. Okay, do I have any closing comments? Otherwise, man, I'm going to give you guys back your 3 minutes, but I am welcoming anybody that wants to stay all the way to 5.
Did we open up for public comment?
Well,
Or
we
ask?
had it up there. I don't know if you guys see it, but we had it up there for,
Oh.
I don't know. I didn't, is anybody on for public comment? Just to make sure that it's clear.
Yeah, I wasn't sure if Jamie was during public comment or not, but yeah, I think so. So fair
Yeah.
enough. Thank you.
Okay, he spoke when this was up, so I'm assuming that's what he was thinking as well. Okay, with that, it's still a beautiful afternoon. You guys go out and experience some vitamin D.
Yes, you too.
Okay, bye-bye.
Everyone, have a good day.
Bye.
The mayor is doing